Bismillahirrahmanirrahim. Hypertension in pregnancy, the NICE guideline, that is our main topic of discussion today. Basically, we are going to study the first point of this guideline, reducing the risk of hypertension in pregnancy. Okay, this guideline was published in 25th June 2019, and it gives us an overview about the management of the patient with hypertension and how to reduce. Okay, so reducing the risk of hypertensive disorder in the pregnancy, that is basically the first point in this guideline. Okay, so how would we reduce the risk of hypertensive disorder in the pregnancy? That is by telling the symptoms of the preeclampsia. Advise the woman to see healthcare professionals immediately if they experience symptoms of the preeclampsia, and the symptoms of preeclampsia include severe headache and problem with the veins such as blaring or flashing before the lights, eyes, and severe pain just below the ribs, and severe vomiting. Okay, so if woman presents with these symptoms, she should tell the doctor. Sudden swelling of the face, hands or feet. Okay, these are also the symptoms of the preeclampsia, and women should be aware of these symptoms, because if she is aware of these symptoms, only then we can reduce the risk. Okay, this picture represents the sign of represents the symptoms of preeclampsia. Okay, severe headache, blurring of the vein, and excessive vomiting, nausea and dizziness, and rapid weight gain. Along with the rapid weight gain, she would have abdominal pain and less urine mean oliguria, and changes in reflexes. Okay, so these are all the symptoms. Changes in reflex is basically the sign, but other symptoms should be not to the woman. Okay, so these are the different symptoms which are written in this guideline. Next come the roles of the antiplatelets agent. Not only becoming aware of the symptoms, but also taking aspirin can reduce the risk. Okay, advise the pregnant woman at high risk of preeclampsia to take 75 to 150 milligram aspirin daily from 12 weeks until the birth of the baby. Women at high risk are those with any of the following condition. First of all, hypertensive disorders during the previous pregnancy. Secondly, chronic kidney disease. Thirdly, autoimmune disease such as systemic lupus erythematosus or antiphospholipid syndrome, and type 1 or 2 diabetes mellitus, and chronic hypertension. So these are the different conditions. Okay, so aspirin 75 milligram, or sometime it is said that 150 milligram is taken by those women who are having these symptoms. So these are basically the high risk women. Okay, the women having hypertensive disorders during previous pregnancy, chronic kidney disease, autoimmune disease such as systemic lupus erythematosus or antiphospholipid syndrome, type 1 or type 2 diabetes mellitus. Women having all these problems are included among the high risk categories. So these are high risk factors, and these patients should take 75 to 150 milligram aspirin in order to reduce the risk of the hypertensive disorders in the pregnancy. Okay, chronic kidney disease, autoimmune disorders, type 1 or type 2 diabetes mellitus, and hypertensive diseases during the previous pregnancy. Okay, then advise a woman with more than one moderate risk factor for preeclampsia to take 75 to 150 milligram aspirin daily from 12 weeks until the birth of the baby. And factors indicating the moderate risk factors include first pregnancy, age more than 40 years, pregnancy interval of more than 10 years, BMI of 35 kg or more, family history of the preeclampsia. Okay, so these are included among the moderate risk factor. If the patient is having more than one moderate risk factor as well, then she has to take the 75 milligram of the aspirin. Okay, other pharmacological, also multifetal pregnancies including the moderate risk factors. Okay, do not use nitrosamine, progesterone and diuretics, because there is no specific evidence that these have any role. Okay, now come to the nutritional supplements. Do not recommend the following supplements solely with the aim of preventing hypertensive disorder in the pregnancy, like magnesium, folic acid and antioxidants like vitamin C and E. There is no specific role of these agents, so it's better not to use these agents. Okay, and then fish liver oils or algal oils and garlic. Now diet. Do not recommend salt restriction during pregnancy solely to prevent gestational hypertension or preeclampsia. Lifestyle. Give the same advice on rest, exercise and work to the woman with a chronic hypertension or at high risk of hypertensive disorder pregnancy as a heavily pregnant woman. It means that is not different. Diabetes for the woman with previous diabetes or gestation diabetes, we have to see the different NICE guideline. Okay, so basically what steps we have taken, okay, for prevention of the hypertensive disorder in the pregnancy. what we have to do, we have to tell the woman about the signs and symptoms of preeclampsia. Secondly, about the lifestyle modification. Secondly, about the aspirin intake. Thirdly, about the lifestyle modification and reducing the risk of the diabetes mellitus and other illnesses. If we deal with that, all these things can help us reducing the risk of hypertension. So first of all, as I am writing, first of all, symptoms of preeclampsia needs to be told to the patient. Okay, symptoms of the preeclampsia, okay, as I have explained. Secondly, 75 milligrams, 75 to 150 milligram of the aspirin, which comes in the form of the Loprin from 12 weeks of gestation onward. Okay, and third is that of the lifestyle modification, about the exercise, about the healthy diet. Okay, the fourth one is that about the addressing the problems related to diabetes mellitus. All these things, if we take actions like these, by following these 4 steps, then we can reduce the risk of the hypertensive disorders in the pregnancy. Okay, so that was all about the topic, and we will see